treatment area. We're treating the kind of jowl pocket here, and then we're going to treat the submental as well. So I like to mark the area. One of the main risks of Kybella is going to be irritation of the mental nerves, and it can cause a temporary asymmetric smile, but that goes away. The results of Kybella or PCD are permanent. And then when we're marking underneath, I have the patient tilt up, and you can see a line of demarcation that you want to stay under, because that'll reduce your risk as well of hitting that nerve. And then we're just drawing little boxes. I usually do 1 cc per jowl area and 2 to 4 cc's for the submental area total. She has a pretty small neck though, so I don't know that we're going to be able to fit as much as I thought, just because it's such a small pocket, so it might be a little bit less. Okay. Might be closer to $1,000. Okay, lean all the way back. We'll see how much we can fit. I'm going to take her ice pack.
But I'm like, oh, I don't think we did like a lot. But I'm like, oh, okay, I'm sorry.
Oh, sorry, honey.
Who put that over there?
Okay, ready? Each injection point normally has about 0.2. I'll take the next one. And then I'm doing 0.3 in this main part on each one. You want to go about halfway in with your 1/2 inch needle.
You have 2 left after that?
Yeah, we won't need that extra one.
Okay.
So you can just make her bill 1,000. Just get a small face.
Do the patient...
We'll see, I actually might use a little bit extra on the jowl area.
Okay. Do the patient communicate to me what exactly Kybella PCDC is?
Kybella and PCDC are deoxycholic acid, which kind of disrupt the fat cells, and it will permanently get rid of fat, much like liposuction. I would say the downside of Kybella or PCDC versus liposuction is you need 3 treatments most of the time, whereas with liposuction you only need 1. It's a one and done. However, with this there are no incisions, so there's no surgical scars, which is nice. With liposuction of the neck area, you usually have a small scar in your neck and behind each ear, and most plastic surgeons will not liposuction the jowl area because of the risk. So if you are going to get liposuction of your neck, you still may need PCDC or Kybella to the jowls. And I am going to need that other one for the upper part here. Okay, you doing okay? Mm-hmm. And then I'll talk about the mental nerve too if you want me to.
Yeah, I'm ready when you're...
There is a risk of inflaming the mental nerve around the mouth, which can cause a temporary asymmetric smile. I have seen it happen to one of my patients. It goes away, but it can take up to 6 weeks. It's usually a really, really mild change. And whenever they smile, one of their lips doesn't come up as high. and just it's the longer that you're swollen, the longer that'll last, but it does go away.
I like you in brown.
You like it?
Yeah, that's like your color. Brown and powder blue. Like I like your powder blue.
Thanks. You doing okay, Becky? Mm-hmm. Does your husband know you're doing this? Take that as a no.
He doesn't really know what I'm doing.
Whenever I'm treating the patient, and honestly at consult, I warn them that there is significant swelling. I almost like to scare them a little bit too much, because whenever you do the treatment and they go home super swollen, they think that something's wrong. So I tell them, like, you're going to be extremely swollen for 4 to 5 days. You can see that it kind of looks like a chipmunk, so I kind of tell them chipmunk, bullfrog. And then I tell them at day 4, they can start gentle massage, like lymphatic massage, which would be just gently pressing the fluid back to the ear and then down to kind of help some of that fluid drain. And then you don't want to repeat the treatment until about 8 weeks, 12 weeks if they still have some swelling. If there's any tenderness in the tissue, that means there's still some inflammation. And then I typically will do, again, 1 cc up to 1.5 cc per jowl area and 2 to 4 cc's in the neck, depending on the patient. Okay, go ahead and sit up for me. Are you still working at a car dealership? Where are you working?
It's the collision